This is a crisis, and I don't think I overstated it when I said this is perhaps the most urgently relevant podcast I've done since I started this because we have kids, young adults, teenagers that are dying as we speak because they are buying counterfeit pills laced with fentanyl. They think they're buying one thing, but they're buying something else. True?
Right. So, and it's not just the pills that are killing right now, Dr. Phil. It's fentanyl mixed in with cocaine, fentanyl mixed in with methamphetamine, fentanyl even mixed in with marijuana. There are some cases in America with fatalities, but what we really have is 275 to 300 a day in America are dying from drugs. The CDC most recent statistics in a 12-month period ending June of 2021 reveal 101,263 dead Americans from drugs. It's also now the leading cause of death for all Americans aged 18 to 45. But we are seeing many kids as 12 years old dying, 13, 14, 15.
When you say it's a leading cause, specifically, what are you saying is the leading cause?
Fentanyl poisoning, okay? They call it fentanyl overdoses, but I call it poisoning because that's what it is. More prevalent than COVID deaths, car accidents, and even suicide.
Okay, so we're not talking about just drug use. We're talking about fentanyl poisoning in the drugs that are being purchased.
Right. A great example, Dr. Phil, is some 14-year-old sees his mother taking Xanax, has no idea what it is, goes online and it says it's for anxiety and depression. So that person then wants to get some Xanax. They'll take a pill from mom's pill bottle, feel great, feel really good, take another pill. But then when the supply's out, we'll go to Snapchat, go to social media, try to buy one. But unfortunately, the fake pills that are being sold on the internet are coming from Mexican cartel labs, and they're making fentanyl-laced pills, and they're making all types of different products with fentanyl, which is killing Americans at record levels, as they have a lethal relationship with the Chinese transnational criminals as well.
Well, we're going to talk about that some more in a minute, including the drug laundering. But Tim, he says they're going online and buying this. Now, you're CEO and co-founder of the health and technology company S3 Research, and this was created to identify illicit drug dealers online. What does that mean? You've got stakeholders like Google, YouTube, Snapchat, because you're trying to find and ferret out these people that are selling these drugs online. So how are they doing that? How is this working, Tim?
First, a little bit of background on the company. It was actually started by a federal grant from the government. So the U.S. taxpayer is supporting the development of this crucial public technology that focuses on a need that a lot of technology companies aren't meeting, and that is removing illicit drug dealers on their platforms. And so the problem is that these drug dealers are across all the platforms, across all parts of the internet, including internet search engines, social media, and the dark web. And in order to understand their tactics and their marketing approaches and how they entice people to buy their products, you really have to have a landscape view of what's going on. So they're very aggressive in marketing. They're just like any other marketer. They use hashtags. They use very descriptive images of what they're trying to sell. They target certain users on these platforms because they're talking about substance use disorder or they're talking about other things. And they are very much socially active, reaching out to people, trying to get them to buy their products.
You say that we've seen a volume of around 80 to 90,000 dealers on social media over the past 2 years across different media platforms?
Yeah, and we see even more as we look into new platforms such as Discord and Telegram that are more encrypted and private. That number just keeps going up, and that could include people who are active drug dealers who are posting messages. It could be comments to other users trying to get them to buy drugs, and it could be other types of advertising material. It's the scope is really hard to grasp.